The Supreme Court in the Philippines is set to debate the legality of a new law on reproductive health. The measure would fund access to contraceptives for some of the country's poorest women. It would also make sex education in public schools mandatory. The law was originally suspended in December after being challenged by the Catholic Church. CCTV's Barnaby Lo reports from Manila.
It's a showdown that's been going on for over a decade. On one corner, supporters of the reproductive health or the RH law, a family planning, contraception, and sexual health measure that took nearly 14 years to pass. On the other corner, the Catholic Church and its allies, staunch opponents of the Philippine law, now temporarily suspended. They've brought the fight to the Supreme Court, saying the law violates the right to life of the unborn child and is therefore unconstitutional.
We already identified 3 pills which are not only contraceptive but also abortifacient.
Translation, that the law promotes abortion, as it will require the government to provide free contraception and reproductive health care. But its proponents say there is no scientific basis for the claim.
Family planning contraception prevents pregnancy. Abortion is termination of an established pregnancy. How can you abort something that's not there?
But the Catholic Church says it doesn't matter whether the Supreme Court decides to uphold or reject the Philippines' reproductive health law. Its leaders vow to continue voicing their opposition through whatever means necessary.
They will speak, of course, about church teaching on natural family planning, morally, and the church always stands on moral grounds. That is where it has to speak and to stand.
No objection to that, say supporters of the RH law. But they're afraid that for each day its implementation is delayed, more mothers are dying of childbirth complications. Barnaby Lo, CCTV, Manila.